Hello, Jack here, and in this episode I'm going to talk about surgical alternatives to going on testosterone replacement therapy for trans men and non-binary folks who are unable to go on HRT due to something like medical contraindications. A few months ago I posted a video about natural transitioning and F to M alternative, and in that video I explained that the book is largely full of shit and there really is no way to use over-the-counter supplements and lifestyle changes to mimic testosterone replacement therapy in an AFAB body. While I was researching that video, I was also writing about it in my personal Twitter account, and that initiated a couple of discussions with some people who follow me who do desperately want the effects of testosterone replacement therapy, but who will never have the opportunity to access that because of a medical contraindication, and they were rightfully very disappointed that stuff like this doesn't work, because they were holding out hope that even if it were a long shot or really difficult to maintain, maybe it could help them achieve some of the effects that they would have gotten on HRT. And in addition to these people, there are people out there whose bodies just don't respond to testosterone, regardless of where it comes from or how much they use, and transition options are limited for people in that situation. But although there are no natural alternatives to testosterone replacement therapy that will increase your T levels enough to affect significant changes on most AFAB bodies, that doesn't mean that there are zero alternatives to going on testosterone, period. And there are actually a number of surgical alternatives that might work for some people who are unable to go on TRT. These procedures are all pretty common in trans men and non-binary folks who do go on testosterone and find that it doesn't affect them as much as they need it to, and there is no biological reason that they shouldn't work on people who aren't on testosterone at all. And in fact, some of the sources that I looked at when compiling this list specifically mention trans men and non-binary folks who aren't on HRT as potential beneficiaries of these procedures. Just a couple quick FYIs before I continue. These alternatives are not perfect. They might not necessarily make you look and sound exactly like you're on T, because testosterone has far-reaching effects that aren't always immediately obvious. You also might not individually be a good candidate for all of them, depending on things like your body shape and what contraindications are preventing you from going on HRT to begin with. These are all things that you'll need to talk to a medical provider about to determine what's best for you. I don't personally have the ability to talk about every single contraindication to these procedures. And things like whether or not they're viable replacements for testosterone are largely going to be in the realm of personal opinion and your individual situation. If you don't have medical contraindications and merely don't want to be on a lifelong hormone medication, it would probably be more effective for you to simply go on HRT for a while and then wean off of it once you've experienced significant irreversible changes. I'm not going to tell you how to live your life, but I'm just saying that these aren't necessarily full-on alternatives to testosterone replacement therapy. They just grant some of the effects of it. They're also expensive, especially if you need all of them. While some of them are regularly covered by really trans-inclusive insurance, some of them either won't be covered at all, or you might need to kind of pester your insurance to cover it. I know some people who have gotten some of these procedures covered because they were able to make a case to their insurance company that it was medically necessary because testosterone replacement therapy essentially hadn't worked well enough for them, and this might be easier for you to justify to them if you have a clear medical contraindication that's preventing you from going on testosterone indefinitely. I can't make any guarantees there. My goal with this video is just to make you aware of some less common types of surgery commonly performed on transmasculine people that might help fill in some gaps if you are really unable to get on HRT. First, let's talk about body shape. Testosterone changes the way fat collects on your body pretty dramatically. One way that you could potentially get this effect without going on testosterone is body masculinization surgery, also known as masculine body contouring, or as the trademarked term, man sculpture. This is a liposuction procedure that takes fat off of areas generally considered feminizing, like the hips, buttocks, and thighs. And that's done in order to create a more masculine silhouette. This commonly is done on trans men who have been on testosterone for a while but find that there's stubborn fat deposits that continue to feminize their bodies regardless of what they do fitness-wise. But it doesn't, strictly speaking, require people to be on testosterone to work, and there are surgeons who advertise that they do it on people who don't use testosterone. This is one of the more invasive procedures in this video, but it is less invasive than a lot of other surgeries trans people get, and it is often bundled with top surgery. Second, facial and body hair. Probably the most effective way of getting permanent facial hair or body hair without going on testosterone is follicular unit extraction, or FUE, which is a type of hair transplant. It's the exact same procedure that's done to add more hair to a thinning hairline or a thinning crown. If you watch the Try Guys, there is an episode or a set of episodes where Zach Kornfeld gets a hair transplant. It's the exact same procedure, it's just in a different location. To do this, they take hair from somewhere else on the body, usually the back of the head, because the hair is a bit thicker back there, and then they transplant it to wherever else you want hair to be. There are some hair restoration practices that advertise this service specifically to trans men who want more substantial facial hair or chest hair, and I've seen this advertised as a way to hide top surgery scars as well. Like all these procedures, typically it is done on trans men who have been on testosterone for a while and find they just don't have the follicles to grow the kind of facial and body hair they want, but I have seen it done on trans men who aren't on testosterone. Next, we have two kinds of surgeries that are regularly performed on trans women, but people often don't know that they're also performed on trans men. In trans men, it's often assumed that we all will be able to access testosterone, and that testosterone will effortlessly grant all the changes that we need, save for top and bottom surgery. So there tends to be a vague perception out there that trans men need less surgery than trans women because testosterone is so powerful. While you certainly do get a lot of lucky people who just develop perfectly into the men of our own dreams without any other assistance, you also get plenty of trans men and non-binary folks who find that people still read their faces or voices as female, no matter how long they're on testosterone, and that's just people who are able to get on it. So yes, these surgeries do exist for us too. One of these surgeries, the third type of surgery on this list, is voice surgery. A lot of trans men's voices don't drop enough for them to be comfortable with how they sound, or even enough to be read as men or androgynously, depending on what they're going for. For people in this category, or who can't go on testosterone to get any voice drop, there are a couple of surgeries that you can look into that will lower the pitch of your voice. One, which is less invasive, is a vocal fold injection, or injection augmentation, and that's when something like hyaluronic acid is injected into the vocal folds in order to thicken them up, which deepens the voice. The other is more invasive, but more effective and I believe more permanent, and this is a type 3 thyroplasty, or relaxation laryngoplasty. And there's multiple ways that this can be done, but it involves making a vertical incision down the throat and then operating on the cartilage. This is also the surgery I've seen somebody pester their insurance company about. They are on testosterone, but their voice never dropped to a level that would be read as a man's voice, so they got this surgery to fix that. Finally, we have facial masculinization surgery, or FMS. This is one of those procedures that's starting to become more common. I just saw it on TransBucket for the first time like 2 weeks ago. I was already aware that it existed, I just hadn't actually seen an example of it in the wild yet. Testosterone causes changes to the bone and cartilage, building up the nose, cheekbones, chin, brow line, jawline, and Adam's apple, but these skeletal changes won't occur if the bone has already matured by the time you start testosterone, which is the case for a great number of us. FMS uses either injections or implants to build up those areas into a more masculine appearance. Injections tend to be impermanent. They only last like a year and then you need to get them done again. They are a lot cheaper though, like $500 to $1,000 I believe. Implants should be relatively permanent, but more expensive and more invasive. Whatever the case, this is available, and there isn't any biological reason why it wouldn't work without being on testosterone. So those are 4 surgical options that could grant somebody who isn't on testosterone replacement therapy some of the effects most associated with it. I can't guarantee that you will be able to access it, unfortunately, but I want you to be aware that these exist just in case they help anybody out there. But anyway, until next time, happy trails.